Welcome back, everyone. I'm Dr. Nancy Snyderman, and here's a look at some of the top stories that we're following in today's Daily Dose. The first round of amendment voting is underway on the Senate health care bill, and just moments ago, the Senate voted in favor of an amendment proposed by Barbara Mikulski that would require full coverage for mammograms and other preventive screening tests for women with no co-payment. Senators are now voting on another amendment which would prevent government panel recommendations from influencing insurance coverage. Keep all eyes on insurance coverage. And White House Budget Director Peter Orszag says the current health care reform bills are not enough to cut skyrocketing medical costs. He says the bills must be strengthened to rein in spending, that actions outside of Congress will be needed to cut costs. And that's where we head right now, because tempers flare on the Senate floor over one of the amendments to the Senate's health care bill. Senator John McCain's amendment would send the bill back to the Finance Committee in an attempt to reverse a proposal to strip $460 billion from Medicare. It's an emotional issue on both sides of the aisle.
And there's an opportunity to come forward and make constructive suggestions, not recommitting the bill, because you can't get a scoring on what you're suggesting. So send the bill back to committee, in effect, kill the legislation.
It's paid for by cutting grandma's Medicare by $465 million over a 10-year period of time.
Joining me now is Jim Martin, the president of the 60 Plus Association. He is in favor of the McCain amendment. Also with me, Ed Coyle, executive director of the Alliance for Retired Persons, and he opposes the McCain amendment. Jim, let me start with you. Why do you want to see this bill sort of stopped while it has some forward movement?
Well, we think it's a bad bill for seniors. We don't think that they should be financing health care reform for 30-some million new folks that they're trying to get on the rolls on the backs of seniors. And clearly $460 to $500 billion in cuts to Medicare, that's hurt seniors.
But
that
Jim,
has a terrible impact on senior citizens.
But even Senator McCain, when he was running for president, said there was so much waste in Medicare that if you trim some of the waste and really preserved what was already there, but took aim at the insurance companies, you're not stripping benefits, you're making it better for seniors.
I couldn't agree more with the fact that there's waste and inefficiencies. Let's find those, but let's plow that money back into Medicare as it currently exists.
And Ed, why do you think this McCain amendment is a bad idea?
Well, let's get real about this. Senator McCain, Jim knows this too. Senator McCain's amendment is about two things. One is just trying to stop health care reform from ever getting passed in the Senate, along with his Republican colleagues. And the other thing is to give insurance to the insurance industry. I mean, what this is all about, the $460 billion in savings that we're talking about here, is not coming out of the pockets of seniors. It's coming out of the pockets of the insurance companies that are taking, on average, $3.60 per month from 80% of the seniors in this country to provide so-called Medicare Advantage plans to the other 20%. And the fact of the matter is, the other 20% aren't benefiting from it. The insurance company is.
Ed, I'm going to ask you a question, then Jim, I'm going to ask you to respond to the same question, and that is end-of-life issues. We don't talk, in fact, in this country about death and dying enough. And we know that we spend an inordinate amount of money in the last year of life. We have politicized this to the idea of pulling the ventilator out of Granny. But the reality is, don't we spend our money poorly? And if we talked about the waste and dying with dignity, couldn't we shape the economic model so much? I mean, the fact that in the last 2 years of life we spend so much money, and I would say ill-advised money. Ed?
Well, first of all, I'm glad you raised the issue, because probably the most despicable part of this entire charade that's been going on about this over the last several months has been scaring seniors who think that there are these death panels. And I know my friend Jim has been doing this around the country as well. I've asked in the past, where are these death panels, and who serves on the death panels, and which of the death panels are going to go to visit the patient and say they've decided that it's no longer efficient and productive to keep that person alive? Who are these people? The fact of the matter is, the seniors in this country have been scared to death for several months now over this legislation. I think for a while they were distracted by it. I think finally they've begun to pay attention to it. And only the craziest of the people who are opposed to this are talking about the death panel these days. Now, to answer, I think, your larger question, is clearly people need to make end-of-life decisions. And the original intent of this legislation with regards to the death panels was to help people make that decision, to provide them with counseling, to provide their families with counseling about what to do. No one is going to visit them and tell them it's time for you to go.
And Jim, that was the message that got hijacked even before the summer craziness. The idea that a doctor could sit down and counsel people about options and be reimbursed for it, it got politically hijacked as death panels. You know that was bogus.
Well, perhaps so, but the fact is, if it is bogus, let's just take that language completely out of the bill. It does scare seniors, and well, it should. Look, I think it's rather ironic that the Democratic Party has been talking about end-of-life decisions for a long, long time. I thought it was a little bit ironic, if you will, that President Obama was in Grand Junction, Colorado, when he said this is a bogus issue, it's dishonest. That happened to be the same state where a former governor, Governor Richard Lamb, a Democrat, some 30 years ago, essentially caused a furor in this country when he said, well, because of that huge cost at the end of life, maybe we ought to basically let seniors just stick them in a boat and push them out to sea.
But Jim, you do know that we all die eventually.
Well, we're trying to get around that one, too.
Jim Martin, Ed Coyle. I have to think, I have to tell you, I think Colorado was way ahead of its time. Thanks, gentlemen. I appreciate it very much.
Thank you.
The hard conversations that Americans are unwilling to have. I appreciate it. Let's get a quick check of some of the other